Most of us are familiar with the term PTSD, post-traumatic stress disorder.
But we may not be aware that there are many different types. Psychotherapist Mary Jo Rapini joined us live to talk more about this. Hi, Mary Jo. First of all, let's just talk about PTSD and what it is and why it's important for someone to know what type they have.
It's really important, Melissa, because a lot of people are coming in to see therapists now with anxiety. They think they're just having anxiety or panic attacks, but it's a full-blown attack of PTSD. PTSD is a psychiatric disorder, and without treatment, it can cause real big problems. Not only does it ruin relationships, but you won't be able to function in the outside world.
Mary Jo, you want to let our viewers know about 5 different types of PTSD, and the first one is known as normal stress response. What is that?
Right, that's after you see a traumatic event, or maybe you're in a car accident, or you've had a premature baby during a time of the pandemic when all your family couldn't be there. Anything like that that causes a big stress, causes you to panic. It's the prelude to PTSD. It's not a PTSD yet, but it does take support and maybe 1 or 2 sessions of counseling for it to dissipate. It does go away.
Now, what about acute stress disorder?
Acute stress disorder is what happens. It's not a PTSD necessarily, but many times it's so severe, people will develop panic attacks. This is usually when you see a domestic violence happening, or maybe you hear about an officer getting shot, or you're actually a witness to a shooting or an accident. And what happens is you feel so fearful, but this too will go away if you have counseling. Sometimes medications are necessary, but it doesn't follow the same course as PTSD.
I see. Okay, number 3 is something called uncomplicated PTSD. What's that?
Right, this is the most common one, and this is the one we used to relate to the police officers and maybe military people, but now we're seeing it with physicians as well. It's when you see one traumatic event and it just gets you, it changes you. This is just PTSD. It's treatable with the right diagnosis, and then you get medications, you get therapy, and support groups are very helpful with this type.
And we're almost out of time, so can you walk us through complex and comorbid PTSDs?
Yes, the complex is when you see many traumatic things happening, like what's happening in the medical facilities during COVID right now, or maybe you're the loved one at home and you can't get to your loved one, and this continues to happen with other people. This type needs a health team. You need an intervention, and you're going to need treatment for quite a while.
Okay, I had no idea there were all these different types of PTSDs, but a lot of people suffering from it. So thanks, Mary Jo. Appreciate it.
Thank you for having me.